What is creamy discharge after implantation?
Hello, and welcome to our video on understanding creamy discharge after implantation. This topic often raises a lot of questions, particularly for women who are trying to conceive or who might suspect that they're pregnant. It's very important to be aware of the changes in your body, as they might give you early clues about your pregnancy status.
What is implantation?
Implantation is a critical early stage of pregnancy, occurring usually about 9 to 12 days after ovulation and fertilization. It's when the fertilized egg, or blastocyst, has traveled down the fallopian tube and attaches itself to the lining of the uterus. When this process occurs, some women might experience what is called implantation bleeding or spotting. This can sometimes be mistaken for a light period, but it's usually lighter and lasts for a shorter duration.
What is creamy discharge?
Now that we understand implantation, let's move on to what we mean by creamy discharge. Vaginal discharge is a normal part of the menstrual cycle. The texture, color, and volume can change depending on the phase of the cycle. Creamy discharge is typically thick and white or off-white, resembling lotion or cream. It is generally healthy and normal if it doesn't come with any other symptoms such as itching, burning, or an unusual smell.
Creamy discharge after implantation. What does it mean?
So, if you notice a creamy discharge after the time when you suspect implantation has happened, you might be wondering what it means. This type of discharge can sometimes be an early sign of pregnancy. After implantation, your body starts to produce more of the hormone progesterone, which leads to increased production of cervical mucus. This often results in a creamy, white discharge. However, it's crucial to understand that a creamy discharge does not necessarily confirm pregnancy. As mentioned before, creamy discharge can be part of your normal cycle as well, particularly in the phase after ovulation and before your period begins. Therefore, it is not a definitive sign of pregnancy, but more of a possible symptom among others.
When should I be concerned?
If you notice a drastic change in your discharge or it is accompanied by other symptoms such as itching, burning, a strong unpleasant odor, or pelvic pain, you should seek medical attention. These could be signs of an infection or other medical condition that needs treatment. If you believe you might be pregnant and are noticing any unusual symptoms, it's always best to consult a healthcare provider. In conclusion, a creamy discharge after implantation can potentially be a sign of early pregnancy, but it is not a definitive sign and can also be a normal part of your menstrual cycle. Always listen to your body and don't hesitate to seek medical advice when something doesn't feel right. Thank you for watching. We hope this video has been helpful in understanding your body a bit more.